Hernia of the spine is a symptom. Many things can be called a hernia spine and therefore can lead to misunderstandings in the moment when we try to find its effects. The hernia of spine can be diagnosed in two ranges. First, what causes hernia of spine? It's a serious decline in self-esteem, that is, the feeling that I have become a person of category B. I do not know what to do with myself, I am useless, I am a burden, I'm not good, I'm not enough good. These are the effects of changes causing a hernia of spine. Hernia of spine can occur during the period of active as well as during the recovery from the disease. More frequent because almost 80% are the symptoms caused by swelling concomitanting the period of recovery from illness. What is frequently diagnosed as a hernia of spine? It could be at first bone lesions, atrophy of spinal bones, namely atrophy of vertebra. Second, it may be changes in the cartilage. There is a difference in the perception of emotions by these two tissues. Both react to the decline in self-esteem on the primary central drop in self-esteem. In the way that on cartilage influence milder changes often linked to mobility, and the bones are those tissues which affect the heaviest states fall in self-esteem. During an active, both these tissues weaken. Weakening manifested by depletion of tissue. If someone have long drop in self-esteem and it do not return to normal, it may happen so that the bone or cartilage so will weaken, so will depleting that cause a jam nerve. Then we have to deal with lumbago or sciatica, when even the small movement there is pain, even whole legs pain, in the abdominal cavity, back pain. Thus within an active period, due to the depletion of the tissue, occurs this jam. It also can be diagnosed as a hernia of spine. In the period of recovery from the disease, when someone's self-esteem returned to normal, starts the process of rebuilding bone and cartilage through concomitant inflammation and swelling. Then the bone swollen and the from bone even more swollen cartilage tissue. In the period of recovery from the disease due to induced edema occur the same mechanical problem with the jam of nerve as in long active period. And then also they appear pains, during which a man is unable to turn or bend. And this condition also can be diagnosed as a hernia of spine. So hernia of spine relies on a serious decline in self-esteem which rarely appear in the active period and is characteristic of the period of recovery from illness, when self-esteem returned to normal. Since somebody got the job because he found his place, feels good in his skin, and again he have a desire to live, he again feel that he can something to do with himself, then begins recovery. The downside of this condition, this symptom, is that during the recovery from illness, when the edema appears, pain is often associated with difficulties in moving. And then one feels that, for example, oh, I cannot go out into the garden because my back pain. Thus this pain can cause a decline in self-esteem, as I have a hernia of spine, so I cannot move, or I'm not good enough. Then there is the possibility of a secondary problem. Therefore, when someone has back problems, should be careful that at least the symptoms do not do the problem, because in this way he could fall into a vicious circle. The more often, the more times he feels the drop of self-esteem, because now he cannot move because of back pain. The more the tissue depletes, and then as often appears swelling due to a period of recovery from the disease. This is called a vicious circle. Because I have a sense of decline of self-esteem, that I have symptoms and therefore hurt my back, I have a drop in self-esteem. This is the only way you can get out of this. If you wouldn't have a problem of the pain of the spine and therefore lumbago, sciatica, hernia of spine, do not devalue yourself from back pain. Try to realize that this is not a handicap of body but the period of recovery from illness caused by the earlier decline in self-esteem. So we should respectfully refer to this pain, realizing that is okay, this is so because before broke down the sense of my self-esteem. Thank God returned to normal. Therefore exist for me these symptoms. And this with peace you need to survive. You get used to these symptoms, gradually get used to. But the best thing we can do for ourselves in this period to save yourself problems. It does not perform such tasks, such activities which would be overstrain. Since pain also makes sense from the perspective of biology, it is so that the body can raise the mind, know that I am in the process of being amended. It would be better if you do not jump now, not joking, does not overstrain, because of the complications may arise. So if you feel pain, we have to take it with dignity, accept it. You should in the best possible way to adapt to discomfort but not to burden bone or cartilage because it may cause deform. And this is really the biological justification of pain. He gives the knowledge about what stage are occurring in us changes. That something is in progress, so forgive yourself, take rest. So if someone has a change in the form of a hernia of spine, he should possibly the least burdens yourself. Not straining, avoid serious body movements. Wait until everything goes on. Because it will pass, because the hernia is not the result of damage and just regeneration. And in a short time pain will go away and you will be able to do sport. Symptom or result of such central core decreases of self-esteem is, for example, curvature of the spine or scoliosis. Thus when someone has changes on the right, then his spine will be curvature to the left. A person right-handed, change appearing on the right side of the body. That affects connective tissue, bone, cartilage or muscle, is always the result of a weakening of self-esteem associated with a partner. For example, a child whose spine is curvatured to the left. If she is right-handed, the body is proof that it feels decline in self-esteem because of his father. Sometimes she is depreciated by the father, saying, for example, son, you're so weak, so stupid, not good for anything. And because in this way he causes a decrease of self-esteem in his child, the age of 10 or even 5 years until the end of adolescence. This proves that occurring ailment is caused by the relationship with his father. If the mother is the one who depreciates child, humiliating her and confirming the belief that it is worth nothing, weak, etc. So in a right-handed man will be thickening of the bone or cartilage on the left side of the spine. Then on the right side he will deflect spine. So scoliosis or curvature of the spine is the result of declines in self-esteem. The question is what to do with someone with whom there was and who underwent a decline in self-esteem, but returned it in him to normal. So he experienced the symptoms of the period of recovery from the disease, and in whom disappeared swelling and inflammation and only left is thickening. There are changes in individual tissues, whom the meaning from the viewpoint of biology is revealed at the end of the period of recovery from the disease. Thickened tissue should better fulfill its purpose. True, but if someone repeatedly passed this ailment, his tissue, bone and cartilage were permanent thickening, and therefore has trouble with moving, it can reverse by gradually increasing the burden, will causing that his body will realize that the joints have too narrow range of moving, that friction is too large there, which is not associated with pain but our brain knows it, and in this way way after a long time returns to normal joints. Therefore do not despair if someone has a curvature of the spine. Also do not despair when someone vertebra in his cartilage or vertebra alone have thickened. Therefore the gradually increasing effort initially through physiotherapy and later by the sport moving or performing specific exercises can restore its original shape. In biology this function creates the organ. And if I use the organ my brain will do everything that I could use it for its intended purpose. Problem appears and we can start to worry when a man fixed on the fact that his spine is quite stiff and cannot move or tilt. As it happens typically the disease spondylitis. The spine becomes woody stiff once said that calcified and hence its stiffness. Today we know that it is not calcified but the thickening associated with many drops self-esteem as a result of which the spine can really stiff. So if someone's spine not completely stiffened and may even a little move, he is not yet at a disadvantage because at the beginning of gentle physiotherapy but still increasing burden can run his spine and achieve to he did not have to spend a life in a wheelchair. Most important therefore is not to fall into a vicious circle. When you suffer from a hernia of spine, sciatica, painful lumbago back pain, therefore not depreciate yourself because if in that way we start fall in self-esteem and back and forth we will fall and leave it. The final result when the period of active joint is devastating and during the recovery from the disease thickens. And so alternately active period, the period of convalescence, active period, the period of convalescence. If it takes a long time our spine really stiffen. This should be prevented by being cool, not giving rank of a problem or dilemma of pain of spine. Thus we prevent the recurrence of pain or suffering because of the new. The changes will not be significant and as soon as possible pain will go away. If someone is suffering from back pain, which I repeat may occur both during active when the joints deteriorate and during convalescence when formed on the cartilage bulging and there is a swelling of the cartilage. Firstly in the inflamed, second it is sensitive and in addition is pressured. By this we feel the pain. It is true that using different techniques of chiropractic you can restore the correct positioning of cartilage so to the least hurt. However, when someone is in the process of changing the periods of illness, gradually and carefully they should be used. So wise chiropractor or physical therapist takes into account in which the period of change is the patient. Because if cartilage are in inflammation then it shouldn't be shaking right or left as is the case with crooked spine. So here is the fundamental difference. So chiropractic is a very useful and meaningful occupation, and properly used the spine can be repaired thanks to it. Anatomical structure of our spine is aligned precisely. Usually the cartilage are special recesses where joints can be arranged. Then the man relieved say all day crooked in front of a computer and his joints deformed, but it can be by a professional movement put them back in the correct manner. But it only can make sense and use if it does not just pass changes. Because if the joint is inflamed then we should take it very seriously and take care of it. Do not do any sudden movements, let's minimize burden, relax, and very importantly let's find a position where we feel little pain. Because by the pain Mother Nature is trying to convince us to keeping back limbs and joints at the correct angle. If this burdened the least painful position we will stay, it will optimize regeneration. And when the swelling subsided again we can use the joint in the full extent as intended. If at the persistent swelling we strain or excessively move joints, according to the old rule, it hurts so you need to disperse. then it can lead to deformity. From the biological point of view, it is not optimal. When a man hurts his back joints vertebrae, they are inflamed, it definitely should be a weight. But if there is no inflammation, swelling subsided, then gradually please return to start using in accordance with its intended purpose the joint or bone.